Hi Khushboo, what's up?
Hi Akash, I'm great. What's up with you?
Nothing much. I've been seeing a lot of patients with frozen shoulder these days.
Oh, tell me about it. So many of my clients have stiffness in their shoulder, they have trouble moving it.
Really? I mean, is that so
Yeah,
common?
maybe you can help me and tell me about something that we can do for that.
Sure, what we can do is we can collaborate and we can make a video, bust some myths and some facts and some exercises which a person can do if he has a frozen shoulder. What do you think?
I think that's a great idea. It's going to help a lot of people.
Great. So let's do this.
Let's go.
All right. The shoulder joint is one of the most flexible joints in our body. What does that mean? Of course, it is more prone to injuries as well. Did you know that total 2 to 5% of the entire Indian population suffer from this condition? So here I am alongside Khushboo to bust some myths, know some facts, and know a little bit of exercises for one of the most common things called frozen shoulder. Let's get started. In simple words, frozen shoulder or adhesive capsulitis is an inflammatory condition characterized by pain and stiffness of the shoulder joint. Although its cause is yet unknown, but it is most commonly seen in females more than males, diabetics, and also at the age groups of 40 to 60 years. So basically, the frozen shoulder has three phases. First is the freezing phase, second is the frozen phase, and third is the thawing phase. So basically, in these three phases, one of the symptom is predominant. So the freezing phase has pain, which is in predominant form. In the frozen phase, there is stiffness, which is in the predominant form. And in the thawing phase, there is reduction of pain and stiffness both. The patient feels better. So the freezing phase lasts for about 6 weeks. Pain is the most predominant feature. Now, patients complain of a dull aching pain, also like a tooth pain to the shoulder, which is sharp on movements, like reaching out for the seat belt or buttoning the shirt. After the freezing phase comes the frozen phase, in which stiffness is the predominant feature. People often complain of a stiff shoulder and they are not able to carry out their daily activities. The third is the thawing phase. Now, in this phase, patient feels that the frozen shoulder has disappeared. Why? Because the pain reduces, the stiffness reduces, and the patient feels better. Though the biological puzzle is yet to be unraveled, people don't know why a frozen shoulder actually happens. But I'll tell you how it happens. The shoulder joint consists of the bone, the tendon, and the ligament encased in a capsule of connective tissue. So when this connective tissue inflames or it swells up, it causes stiffness of the shoulder, and this is what is called a frozen shoulder. There is no specific time to see a doctor, but I'll tell you when to see a doctor. So basically, frozen shoulder has two components. One is pain, one is stiffness. Talking about pain, if you have severe pain in the initial phases of frozen shoulder, then you can see a doctor. He will prescribe you some exercises, some medications, and some ice packs. The second symptom is stiffness. So basically, stiffness is when you're not able to carry out your day-to-day activities, such as bathing, putting on your shirt, or maybe scratching your back. Then you should see a doctor.
Another very common question that comes is a hot fermentation better or is an ice pack better for a shoulder problem? So this is purely from my experience. I've noticed that applying an ice pack, which should be covered in a thin cloth ideally, and then applied directly to the place of soreness or stiffness has helped in most cases. So I would recommend that after doing these exercises, just ice it for about 15 to 20 minutes on a regular basis.
Myth. It's a myth. Frozen shoulder can be treated in many ways. Okay. So frozen shoulder is basically sometimes a self-resorbing disease. Some people call it like that. That means that it subsides on its own. But there are other ways to treat frozen shoulder. One is exercises and stretches for your shoulder, which will reduce the stiffness. Second is anti-inflammatories and corticosteroid injections. What it does is it just reduces the pain. And third is surgery in the form of manipulation of shoulder under general anesthesia. So it's a myth, frozen shoulder can be treated very well.
So the first one is our pendular exercise. So you take a chair or any raised surface, hold it up with your good arm, and if this is my frozen shoulder, I'm going to just let it hang around here and maybe even grab a small weight like a jam jar if it's accessible, and then move it around clockwise, really getting that swing motion, moving my whole body along with it. Trying to keep the back as straight as possible, 10 in one direction and then 10 in the other direction. The next one, using our chair and maybe a small weight, is swinging it from one side to the other, moving my body as I do that horizontally. 10 or 15 of these. And the last one using this is taking it to and fro, front and back, swinging that shoulder, letting it hang with a small weight, and do this again about 10 to 15 times. Grabbing onto a scarf or a stick or any kind of a towel, you're going to do some forward flexion of the shoulder, so taking it up in line with the shoulders and bringing the hands back to the ground. Grabbing tight, elbows straight, and try to take it as high as you can, at least till the shoulder level, and then some if possible. Do this about 10 to 15 times. The next one is pretty similar, but pay close attention. So, looking at the side of your frozen shoulder, you want to stick the elbow to your body. So don't let the tricep or the arm lift up. Sticking the elbow to the body, and this time you're going to externally rotate the side of the frozen shoulder outward. So keeping it in front, holding firm to your scarf or your towel, and then moving it in the direction of the frozen shoulder. So if my left shoulder is the one that's affected, I am moving it towards my left side, keeping the elbows together. Do this again about 10 to 15 times. The next one is pretty simple, something we often do in our day-to-day. The shoulder shrugs. I don't know, kind of motion. So shrug up, hold it for a few seconds, hold it till a count of 5 or 10, and down. Again, up, hold, pulling the shoulder blades up and down. Up and down. Repeat this again about 10 to 15 times. And for the next one with the shoulders, you rotate them outward 10 times like this, protracting the shoulders and then retracting the shoulders. Let me show you from the side. Protracting, taking it up and retracting. And then after doing 10 of these, do it in the opposite motion. Retracting, bringing it up and protracting. It's the opposite circle this time. Again, 10 of these. Shoulder shrugs, keeping your back and the rest of your body straight. Last one is, if you are comfortable doing this, something that's nice to try. Lay down on your back, arms out, stretched in front, and on an inhale, try to lift up Feet up and arms up, keeping both the arms in one plane, one line, and just trying to sort of retract the shoulders backward, bending the spine a little bit, keeping your glutes active into an arch position here. Really opens up that shoulders towards the back. And then slowly come down. Try holding this for about 10 seconds or 10 breaths.
Lastly, I would want to end it by saying that frozen shoulder is not a very severe disease. Don't hesitate to consult your orthopedic surgeon and your physical therapist, who will actually help you with certain exercises and certain medications wherein you can have your shoulder treated. Don't hesitate. Thank you.